Thank you so much for that warm welcome, and it's really special for me to be here, so thank you for welcoming me, and thank you for allowing me to speak in English, so I'm really grateful for that. So, before we get started, I wanted to ask you a question. If you have a mobile phone and you're on Wi-Fi, please do log into Slido, and hopefully some of you already have, and I want to ask you a question. So, if we can move to the Slido slide, and we'll see how you're getting on with that question. For those of you who don't have a phone handy, perhaps just think about what the answer could be. So the question is, in September 2020, the following was said. Climate change is a mental health crisis, or something similar to that. It will come up in a moment. Or this is a mental health crisis we have here. And I wanted to ask you, who did you think said that? Do you think it was Adrian James, who at that time was the president of the Royal College of Psychiatrists, and he is a committed cyclist, and sustainability was one of the platforms on which he was elected? Do you think it was Greta Thunberg, well-known climate activist, also known to talk about her mental health, so it could have been her? Or perhaps it was Cristiano Figueres, who was the UN negotiator who managed to pull together the Paris 2015 climate agreement. So do you think it could have been any of those people? Now, I think the answer is given away on this Slido. So before we go any further, I'm going to confirm it was indeed Bernard Looney, who was the chief executive at the time of BP. BP is a big oil conglomerate, and you might have thought one of the last people in the world to actually say this. I'm glad you're all catching up and you all knew this too. But it really made me think, because if Bernard Looney is saying this 3.5 years ago, psychiatrists aren't saying this, psychiatrists don't seem to know this, so we should be aware of this, we should know what the evidence is showing, we should be able to talk about this, is my view. So that's what we're going to do today, and that's what I'm going to tell you about today. So, when you're talking on this topic, it is quite hard to know where to start. Do you start with the climate science? Do you go into the debates about the climate science? And fortunately for us, the World Health Organization has recently released a communications toolkit on this, and I've stuck really to the toolkit when preparing this talk today, and I suggest if you ever want to talk to an audience about climate change and its health impacts, it's a good place to go to. So, there are the basics of climate science, that is around what we're polluting the atmosphere with, the greenhouse gases, and the impact that that then has on the greenhouse effect and global warming. Most of us are well aware of that. And what WHO says is these are the places that you really are best to stick to when you're talking about this topic. So, yep, the climate is warming. Yes, it is us, and yes, we are sure it is us. It is bad for health, and I would suggest it's bad for mental health, and we should be able to talk about that as psychiatrists. And also, we can't fix it alone, but we can certainly help fix it as psychiatrists. So that's mostly where I'm going to be focusing the talk today. But before we do, I'm just going to say a little bit about the actual science. So we do know very clearly now that human influence is affecting the climate. So this slide is from the IPCC report in 2021, and what I think it's helpful for is it shows because often the modelling comes in for criticism from climate skeptics, but what this shows is that if we just model natural factors that we know about, so non-human related factors that are likely to influence global temperatures, we can see that there would have been there was predicted to be virtually or very little change to global temperatures, and we can see that in the blue line there. But if we build human factors, particularly the burning of fossil fuels, into the models, we do see an increase in global temperatures, and that is indeed what we've observed. So the modelling is pretty accurate, actually, and if anything, has probably underestimated the effect. But bad news here, it's not just our climate. So we have cleared a lot of forest. That is a problem not just for its climate mitigation effects. Biodiversity is reducing around the planet due to man-made activities. Some people talk about it being the 6th mass extinction even. but we have a lot of species disappearing before we even discover them, is the thinking. Oceans have done a lot of the hard work for us in terms of mitigating against CO2 emissions in the atmosphere, but they're more acidic as a result. And much of our land, particularly in the global south, particularly in Africa, is desertifying because of the changes to the climate. Lots of pollution in lots of systems, and climate scientists talk about, or some climate scientists talk about planetary boundaries. So it's not just around CO2 and the greenhouse effect. We have nitrogen, we have phosphorus cycles, which are impacted, water cycles, other forms of pollution and toxicity. And if we look at all of those, we can see that the boundaries of safe operation are beginning to be breached in quite a few of those now. We've had a really big impact on how our world works. So we've dammed a lot of our rivers. We are seeing a lot more extreme weather events, and I'm going to be talking about those. Temperatures increasing, we've touched on, and sea levels rising. So it is not a pretty picture. It's a worrying picture. But by ignoring that, we are not going to help ourselves. We need to acknowledge it, and we need to look at what we need to do. Just one more slide on climate science. So some climate scientists will talk about tipping points, and many of you in the audience will probably have heard of this concept. This is this idea that there are geographical, geothermal, atmospheric systems across the world which are rather near to being pushed into what are thought to be non-linear cascade effects if we push them too far. And this is a group in Exeter that publishes quite a bit on this, and this is their most recent assessment of this. And I think you can see that the ones to focus on are the tipping points in red, which are likely to be breached around or before the 2-degree mark. So we're likely to very likely, I think, to reach that far. And you've probably heard talk about the Antarctic ice sheets in West Antarctica, the Arctic permafrosts and ice sheets up in the Arctic, which are melting, and coral reef dieback, particularly around the Australian coast and Indonesian coast. And we've already had a lot of dieback events. So those are the tipping points which are likely to go first. The worry is that once they tip and they go, the responses are non-linear, and we can't really predict where that's going to go, but many of them, for example, the Amazon rainforest, will then release inordinate amounts of CO2 into the atmosphere and lose some of the capacity of the Earth to counter that. So that is a worrying picture, I think we would all agree. So what does that mean for us here in Northwest Europe? Well, for the Netherlands, apparently you've already noticed a 1.4-degree increase in average temperatures since pre-industrial eras. So that's higher than we've actually experienced in the UK on average. And what that means is that you are experiencing hotter, drier summers, and you've probably noticed that, with more heatwave days. This information comes from the Lancet Countdown, by the way, which is an international collaboration, but it is based in London, and they do a stock take every November where they look at the health of the climate health of the world globally, and they do a sort of region by region comparison of how countries and regions are doing with respect to the impacts of climate change, but also the mitigation and adaptation to climate change. And this is what they say for the Netherlands. You have an air pollution problem. So they estimate that you have about 9,000 excess deaths in 2020 from air pollution that you need not have had. That, however, has to be tempered with the fact that this has reduced since the early 2000s because you have managed to bring down your air pollution. So that's, I think, also a sign where change can be made, and change can have very direct benefits for human health. Your big concern, obviously, is sea level rise, and my understanding is you have about 5.4 million people who are living within a metre of the sea. That's a different issue to us in the UK. We have a much bigger issue with surface flooding. But that is obviously a concern as we're going to see sea level rise towards the mid and end of the century. And the Lancet Countdown, their view is that you have too many people dying of preventable diseases due to poor diet. So if you were to reduce excess, whatever that means, dairy, red meat, and processed meat in the Dutch diet, you could save around 10,700 deaths per year by their estimates. So that's more about health, but what if we focus in on mental health? Because we're all psychiatrists, we're in the business of mental health, that's what we want to be able to think and talk about, isn't it? So how does mental health fit into this picture? So those are those WHO greenhouse gases again, fairly simple, all to do with pollution, much of it from the burning of fossil fuels and the use of fossil fuels, not all of it, but most of it. So that, particularly the burning of fossil fuels, leads to significant air pollution. And I'm not going to speak very much more about air pollution today, but there's a lot that is in the health press at the moment about the physical impacts of air pollution. WHO has doing lots and lots of work around air pollution and physical health. But it is worth you knowing that there is reasonable evidence, and it's growing all the time as studies are done, that air pollution also impacts negatively on depression, anxiety, probably increases suicide. There's fairly good evidence for that now. Dementia it may have a role in, and possibly neurodevelopmental disorders as well. So the evidence there is definitely growing, but it's a really interesting idea to think that if, as is wished for other health benefits, air pollution is reduced and managed and better controlled, that we may have some very considerable co-benefits for mental health. I'm not going to talk any more about air pollution because I want to move on to global warming and climate change. And the way that health researchers generally look at this is they think about the direct effects of climate change on health generally and the indirect effects. And we can do the same for mental health. So this is a graphic from a report that the Royal College of Psychiatrists put together about 3 years ago now. And it really just shows the areas that we can think about. And you'll notice, bar air pollution, most of these are about extreme weather events. So these are the direct impacts that we can think about for mental health. So heat causes mental health impacts, particularly heat waves. Storms, wherever they are in the world, be they hurricanes, cyclones, or storms, the sort of storms that we experience in Northern Europe are generally less severe, less cost to life, but still have considerable mental health impacts. We also, less of an issue for us here in northwestern Europe is droughts, but a very considerable problem with very considerable mental health impacts for those in other parts of the world. Floods are a big issue in the country I come from, in the UK, and we know that the mental health effects are pretty profound. So the physical health effects of floods in a developed country are pretty minimal. We don't generally see cholera outbreaks or mass drownings in northwestern Europe when floods occur, but what we do see is very considerable mental health effects. So up to 30% of people develop PTSD if their house is flooded. Others develop depression, anxiety, and these mental health impacts are not short-lived. So for many people, and we know this from follow-up studies and cohort studies of flood-affected people, those effects are enduring over the next few years through loss of livelihood, loss of house, change of perspective about how safe people feel and fear for the future. And wildfires are an issue, particularly in North America, Russia, and Australia, and they too have very considerable impacts on mental health. So this slide is from a review published about 18 months ago, where the evidence for this was drawn together, amongst other things, and you can see that what they're trying to do here is to show that this is of relevance across the world, and the actual impacts will vary depending on where you are in the world, whether you're in India, whether you're in Africa, whether you're in South America, but we have evidence now of mental health impacts as a result of these types of extreme weather events. So I'm going to focus on the UK for a few minutes and talk about an area of particular interest to me, which is heat and health. And this is just to show you that heat is definitely a problem that is with us in the UK now in the summer months. So this is data from 2022. And you can see with that top slide, what it's showing is the top 10 highest temperatures in the UK in the last 130 years or so. And you can see that all but one have happened in the last 30 years, and at least the top 3 or 4 have happened in the last sort of 10 years. And our hottest day ever was in summer 2022, is in July, and we reached over 40 degrees, and that is a new record for the UK. And over the summer of 2022, we actually had 5 heatwave events, so those are periods of time where you enter into a heat wave and then dip out again. And our Office for National Statistics has estimated that there were around 3,270 excess deaths as a result of those heat wave periods, and that's about 6% or a little bit more above the national 5-year average. So something's going on here. We know that people who are vulnerable are more likely to die in heat waves, and that is often people with pre-existing conditions, including mental health conditions, although many of these are also older people with multimorbidity. We also know that suicide goes up in hot weather, and this is something that you can see if you look at large data sets across, across populations, and this is a modelled slide to show you the pattern for the UK, but I would expect it to be very similar for the Netherlands. So what you're seeing here is a classic hockey stick plot, and you've got temperature along the x-axis and then relative risk of dying of suicide on the y-axis. And what you can see is that there's an inflection point where the rate of suicide starts to go up, and that will vary from country to country depending on what your mean temperatures are usually doing. For the UK, it's somewhere around a mean temperature of about 20 or 21 degrees across night and day, so that's much higher than it sounds. Where we start to see, after that, you start to see rate of suicide going up. This is modelled slightly differently. This is looking at percentage of temperature. But you see that pattern of plot, and most countries and most temperate countries have a very similar looking plot. We have better data from the US, from Asia, and a little bit from Europe, but we just don't really know what's happening in the really heat-stressed parts of the world. So Middle East, Africa, India, Pakistan, etc. There's much less studies that have been done. So if I were to summarize the heat effects on mental health, if we look at the left-hand side first, which is the bit I'm most interested in, people with mental illness or mental ill health already, so lots of the patients that we see in our practice, they will be vulnerable to this. So, there's this increased risk of suicide, which across a population it's small percentage-wise, but actually, if we're talking about lots more heatwave events, is going to be a significant amount. And other work, not really from Europe, actually from elsewhere, but temperate climates nonetheless show that mental health visits to the emergency department go up during periods of hot weather. We've done work in the UK looking at the mortality of people with serious mental illnesses like psychotic disorders, dementia, substance misuse, and shown that their risk of mortality is higher, significantly higher than for people without those disorders. So our populations that we treat are part of the population that are most vulnerable to premature mortality from heat. And also work done in Germany and a little bit and we've done something recently in Sussex around this, looking at the likelihood of violent incidents occurring on inpatient wards. And we've seen that those go up in hot weather. So our patients seem to be experiencing something that is difficult, and that can be reflected sometimes on the incidents that happen on wards. There's also general population effects, which I've listed there as well, and there's lots of fancy ways that researchers have looked at this, including looking at Twitter posts in hot weather and cold weather. Again, like that suicide data, actually, there's an inflection point where usually most people like hot weather, most people like it when it's warm, when it's sunny, and then it gets to a point where it gets really quite hot, and people's mood, their affect, their psychological distress changes at that point. So there's this sort of inflection point that will vary depending on the ambient temperature of the country that you're living in. And we see, and there's a whole other literature around crime, violence, that shows that there are heat effects there as well. So I've talked about some of these direct effects from extreme weather events, and those in a way are the easiest to quantify, although I'm not saying that's easy, but probably more important are these indirect effects. And I'm not going to spend too long talking about these, but I think you'll understand that actually these have the potential to be much more worrying for us as psychiatrists and mental health professionals. So social scientists and political scientists have looked at the impact potentially of climate change on conflict and war, and they've been able to demonstrate fairly convincingly that there is a link. So as climate change gets worse, land and water resources are more stretched. That's going to cause more places of conflict around the world. And where there is conflict, where there is war, well, we know that's probably about the worst thing that can happen for a population's mental health, isn't it? It's pretty bad, pretty significant effects for those people caught up in that. That's related as well to forced migration. So as land use changes and people are unable to stay on land that they may have been on for many generations, people feel compelled to move. And much of that movement obviously happens within countries. So that's where most of the migration is taking place from rural areas to urban areas often. But remember, it's not everyone who is able to move. So it tends to be those that are healthier that go, and the people that get left behind, the so-called trapped populations, tend to be those with health problems, the frail, the more elderly, perhaps those with mental health problems, perhaps women who feel less able to move with children. It tends to be the healthier people who go to the cities. And that's mixed for the people that go to those cities. That's not always that can be a positive thing for their mental health. But we know, don't we, from we've got, lots of information on what happens to migrated communities, be that within countries or beyond the country's boundaries. And there are mixed effects there, and some of them are negative for populations that are forced to move, particularly if it's against their wishes and they didn't want to have to do that, but feel compelled to. So forced migration is something we're going to see more of. We've touched on land use change, so particularly in the global south, farmers not able to farm and use land in the same way that they have for generations, so land use is changing. And we see changing patterns of infectious disease as well, so particularly dengue fever and malaria are illnesses which are really classic sort of climate change, global warming impacted patterns of disease there. So that in its turn has impacts on mental health. We know that infectious disease is linked to poor mental health outcomes. We saw that with COVID, didn't we? So changing patterns of infectious disease, some of which have been modelled and some of which we've yet to really fully understand. I've put one slide in here about eco-distress. When I tell people that I'm speaking on climate change and mental health, this is usually where certainly the lay public go, and they think that this is going to be a talk about eco-distress or eco-anxiety. I'm not very interested in this, but I have got colleagues that I work with who are more interested, so I'll say what they say, what they usually tell me about it if I ask them. So I think some colleagues in CAM services may be coming across this, by child and adolescent mental health services. So we know that younger people are particularly concerned about climate change and about ecological breakdown, and that feeds into areas of preoccupation for them. I think for many people it's quite right that they're worried. It seems a very adaptive, sensible response to be worried because people should be worried about this. So I think there is a tension between not pathologizing this. The term that we've used at the Royal College, or the preferred term, is eco-distress, but you'll hear other terms used as well. And if people are interested, I'd point you in the direction of the resources we've got on our website. It's a nice, simple resource pack that just has a little bit about how teachers, parents, and psychiatrists can talk about these issues with young people who are worried about it. So, we've covered how it's bad for health, mental health, and I'd like to move on to how we might be able to fix it. So, we're not going to be able to do it alone, so that's why I've kept putting that we can help fix it. We certainly can't do it alone. But we do need to think about these things, and that's because actually about 4 or 5% of global greenhouse gas emissions comes from healthcare. Okay? So we are part of that issue if we're working in healthcare. And this graph is a little bit old now, it only goes up to 2016, but it shows that overall, most developed countries in particular, the amount of greenhouse gas that we're emitting in our healthcare services is increasing over time. And we can see the big outlier there is the USA, who emits at least 8%, possibly more, of their overall greenhouse gas emissions is from their healthcare system. So usually the more intense, the more investigations, the more inpatient work is done in any one system, the higher the greenhouse gas emissions. So another way of thinking about this is if all of healthcare in the world were a country, it would have the same emissions profile as Brazil. So it is a big issue. So we need to be aware of that and know that, I think, in healthcare. So what's happening here? Well, in COP26, which was 2.5 years ago now, 2.5 years ago, your Minister of Health committed to the following. So they said that they were going to regularly conduct an assessment of the environmental footprint of what's going on in your health sector. They said that they were going to support the sector to deliver healthcare in a more environmentally sound manner, and also to facilitate the development of a sustainable, low-carbon healthcare supply chain. So, I wonder actually if we could go to the Slido slides next. We're going to wake you up a bit and do a bit of this. So we've got, we should have a quiz of 3 questions now. So if you were on Slido before, get back on it. And maybe you can answer these questions for yourself and for the audience. So the first question is about you personally. Well, can we go back a question, actually? There should be one before that. Okay. Don't worry, we're answering this one. So the question is, have you tried to reduce the environmental impact of your psychiatric practice? You can be honest, and I realise there are some people not answering this who may be more in the no category. I'll tell you what this looks like in the UK. So the yes is well below 50%. We're talking 20% or less when I've given this talk in the UK. So perhaps we're doing well here. Okay, are we able to go to the Slido before that? So the first question, okay, we'll go to this one. Have you heard of this, the Green Psychiatry Handbook? Okay, it's a Dutch publication from 2023. And I know there will be people in the audience who wrote this handbook and were involved in it. And I'm just really interested to see how many people have heard of it. Not have you read it, but have you heard of it? So about a third have heard of it. That's pretty good. And I think if we asked this in the UK to a similar audience, fewer would have heard of our publications from the Royal College, for example. Okay, let's go back to my slides then. So that's what the Green Psychiatry Handbook looks like. So hopefully you'll all want to have a look at it. I had a look at it, and unfortunately, because I don't read Dutch, I wasn't able to tell you much of what's in it. But what I am going to tell you is what we're doing in England, and we can see how maybe it compares. So just to orientate us, not that long ago actually, less than 4 years ago, NHS England committed to be net zero by 2040. So that's for all of the emissions, the greenhouse gas emissions that it is responsible for. 2045 for those in its supply chain. And we responded at the Royal College of Psychiatrists in May of 2021 by publishing a statement around this, looking at the evidence that climate change is going to impact on mental health, and looking at that point around broad sort of principles around what we might do about that. In July 2022, Greener NHS published a report which was pretty important at the time, called Delivering Net Zero, which really was the first place where it was set out what this roadmap might look like for healthcare in England. And in April 2023, all NHS, so publicly funded organisations, had to come up with what was called a green plan, which is explaining how they were going to become more sustainable and move towards net zero. So every mental health trust in the country now has a green plan that is publicly available. About 6 months ago was the first of the UK specialties to publish a report, and it was the surgical team that got there first. So they published a green surgery report. Super important because surgery is such a carbon hotspot for healthcare. So that's a really landmark, important report. And we followed the next day with our report into net zero mental health care. And it's those two publications in green that I'm going to focus on next. So Greener NHS is an arm of what's called NHS England, so it's the overview, it's the parts of the system that aren't delivering healthcare directly, but they're overseeing that. And the Greener NHS initiative was the first time that any healthcare system had said it was going to go to net zero. So it's the first to make that declaration. Lots of others have followed suit, and usually there's an update every year at the COP about which health systems are now saying that, and the Netherlands is amongst there. And this publication was an important sort of roadmap for what that might actually look like, having the Greener NHS team having done some work around that. So what does it look like for healthcare in general? So this is a wheel that shows the carbon equivalent emissions for the different parts of healthcare. And I've ringed there in green the parts that are most relevant for mental health. So you can see a really, really big chunk across healthcare is our medicines, pharmaceuticals, and also medical equipment. And that, I think that's really important to recognise as clinicians. About 10% is buildings. Most people overestimate how much it actually is to do with buildings. It's about 10% of the footprint. 5% is waste and water and so on. And then about 15% is patient and staff travel. So a significant chunk actually is the travel. And if we look at that in terms of mental health services, which the Greener NHS kindly did for us, this is very estimate, I would say, though, and I think we can definitely interrogate this more, but this is what they thought. So I've ringed there in red how much they think mental health is responsible for, and I should say that overall, it's been estimated it's about 6% in the UK, or in England at least, of total healthcare carbon emissions are probably mental health. So 6%. It's not a huge chunk of it, but on the other hand, it is pretty significant if you think overall healthcare is responsible for about 4.5% of UK emissions. So it's not nothing. And what we can see is that it's spread much more evenly than in the acute sector. So we don't have as much buildings energy. I think what we could take issue with here is the medicines, actually, because, yes, these are medicines that we directly prescribe in the UK, psychiatric medications. We don't have lots of new fancy medications. We're using quite a lot of older medications, aren't we, in mental health? It's not like oncology, for example. So the carbon footprint is estimated to be low, but I think what this underestimates is the fact that when we have a tendency in mental health to overprescribe and also to not stop medications when they're no longer needed or no longer effective. And certainly in the UK, when psychiatrists start people on medication, our primary care tends to carry them on and is reluctant to stop them, reluctant to bring people off them, if not instructed by a psychiatrist often. And so people can stay on medications for many, many years when perhaps they don't need to. So I think our footprint is bigger than we might imagine, actually, in terms of lifetime emissions of the medicines that we prescribe or initiate. But I should say that there is no good, there's very, very little data on the actual carbon footprint of our care pathways. We just don't know at the moment. So that brings me to this report, which was published, so it's the one I mentioned, we published in November of 2023. It's got a long title, so Delivering Greener, More Sustainable and Net Zero Mental Health Care. Originally, Greener NHS were keen to have it as a pure net zero Commission report, and we were able to work and show that, and convince them that actually it needed to be broader in its scope than just about carbon emissions. We need to be looking at our services being more sustainable in other respects other than just the carbon impact. And this was the wheel there represents the lens that was brought to the work. So first of all, it's about keeping people healthy. So the most sustainable thing you can do is keep your patients well, keep them functioning, keep them out of hospital. That's the most important thing to bear in mind here. It's also about delivering the right care at the right time and making sure that the treatment that you're using is appropriate, evidence-based, and the right combination of treatments for that patient at that moment in their life. And yes, we need to be thinking about carbon in our care pathways. How can we reduce waste, minimize unnecessary travel, for example? But that's only one part of the picture. And underpinning all of that is clinical leadership, because this is about systems, how systems work, and it's about the workforce being able to be empowered to deliver this type of care. So this is quite a busy slide, while you're having a look at that, I'll just explain how the net zero report worked. So we were funded by Greener NHS to do this work through the college, and the college was able to employ several researchers to work full-time on this project. So they did a literature review around low-carbon pathways, sustainable practice. They also reviewed all of the green plans that had been published by all of the mental health trusts across England, and they looked at best practice, they looked at what made a green plan useful and good, and what were the kind of bits that were generalizable to other trusts. And they also had an expert reference group who met regularly and reviewed the evidence and inputted. So bringing all that together, they were able to come up with some areas where it was felt that there is high carbon impact. And this is a busy slide, but I'll just bring out a couple of things. So I've already mentioned medication. So polypharmacy and overprescribing. So are we really doing what we need to do around making sure that our patients are not on excessive amounts of medication, excessive doses higher than they need, for longer than they need? Are we regularly reviewing that? Are we using pharmacy colleagues to do that? And are we communicating well with primary care colleagues about how to bring people off medication when the time comes? We also looked at inefficient and wasteful practice. So, for example, people needing to use crisis pathways again and again and again because the community offering for them is insufficient and isn't holding them. That's a very distressing way for people to have to use services. Patients don't want to be doing that. Practitioners don't really want to be perpetually responding to crises, and yet that's sometimes what we see. So that's also a very carbon-intensive way of working. So that's the way I'd look at it. Always look at it at the clinical issues first, and then is that working environmentally as well? Or usually what you find is where it's not working clinically, it's also not working environmentally. So can we better work out the offering for people who have a tendency to go into crisis, so they're not having to use accident and emergency departments, they're not having to use police or other responders, and that is working much more smoothly than it should be. When it comes to inpatient treatment, for any area of healthcare, inpatient treatment is always the most carbon intensive. That's true in psychiatry and in other specialties. So what happens where we've got inpatients who are stuck and are spending too long in inpatient care because there's nowhere for them, no good community supported placement for them to move into? What about people who, what about us overusing mental health beds because of that issue? That is not good for patients, that's not what they want, it's not good for carers, and it's also not good for the carbon footprint of the service. So another issue in the UK, I don't know if it's an issue here, is out-of-area placement. So you may have someone becoming unwell in Sheffield, but there's no local beds, and they're shunted halfway across the country to a hospital in Kent or Sussex, for example, often in the private sector, often leading to longer lengths of stay than if they weren't being shunted such long distances. We know patients don't want that, carers don't want that, and the local staff don't want that, but it's also a carbon hotspot when that happens. So I'd encourage you to have a look at the report if you're interested in this. There were a lot of recommendations made under 10 main areas. I'm not going to go through all of those recommendations, and they're divided up actually into, so some are for policymakers, some are for clinicians, some are for service managers, and so I would say there are bits in there for, there's quite a lot in there for clinicians. I'm going to draw your attention to these 3 or 4 areas. So sustainable prescribing, and I think, again, the college is starting to do quite a lot of work around what does that actually mean. We're starting to get more information around the actual life cycle analysis of psychiatric drugs, for example, which should help with that. When we're doing quality improvement projects, let's bring a sustainability lens to that. And we've got lots of resource in the UK about how you can do that through the Centre for Sustainable Healthcare. So we can encourage our juniors who are doing quality improvement work to bring that sustainability lens to the work. Promoting nature-based mental health care is something that we'd like to see more of. And very importantly, making sure that our mental health workforce is sustainable, because where we have lots of vacancies and turnover in staff, that's not a sustainable picture to deliver healthcare. So just before I finish, I'm just going to show you this, which is a recommendation area from the report, and it's the one on nature-based mental health care. And you can see there's, don't read it in detail at this point, but there are 4 main areas there that were highlighted, supported by evidence. So supporting patients to actually engage in activities outdoors was one recommendation. Integrating it into the delivery of routine care was another recommendation. Knowing what's available in your local area, so having a good map of what actually is going on in your area, particularly as these nature-based work is sometimes done in different sectors. It's not done in the health sector. And making sure that staff are properly trained in how to integrate this into the offering for patients. So nature and mental health, I think there will be a lot of people here who are interested in this area, and I think it will be something we can talk about later at the panel discussion. But I would bring your attention to, I think, something that is just innately seems true to most people, that nature is an important part of most people's lives in some way or another, and it's an important pillar of well-being. There's lots of work and evidence around how nature can support population-level mental health, and there's much less work on how green care or nature-based interventions, nature-based therapies can be used in the sorts of patients that we work with. But I would say that given that we know that there are so many well-being benefits for the rest of the population, it's really important we don't leave our patients out of it. And many of our patients live in highly urbanized environments. They have very little access to outside space. They may have many reasons why they don't feel very comfortable accessing outside space, particularly without some scaffolding and help to do that. And unfortunately, if we're not careful, they can be left out of this kind of nature well-being movement, I think. I'd also, just before I finish, draw your attention to this document, which was published last month in the UK. It's a review of reviews about what nature exposure means for health generally. So there's been quite a few reviews done on this area, and this is kind of reviewing all of those reviews. So it's bringing that evidence together, published by an organisation called Natural England in the UK. And it's very measured. There's lots of stuff about physical health in there, and the mental health bits that leapt out to me were that they were able to say with a high degree of confidence that exposure to blue, which means rivers, coastal areas, water, and green space improves mental health and well-being for everyone. They were able to say that nature-based interventions do reduce depressive symptoms. The evidence is less strong for other areas, largely because the work is, much less work has been done, I think. And they've definitely highlighted this need for doing more research in specific clinical groups, including, the sorts of people that are seen in secondary mental health services. So that's just one example from where I work in Sussex. We've got a great woodlands project up in the woods, beautiful spot in Sussex, and this was a piece of work that was done with an early intervention psychosis group that went up and did an 8-week weekly session up in the woods with a nature-based instructor and some staff members as well. And it was really, really valued by the patients who participated, but also the staff who took them there. And there were just some really nice qualitative aspects that came out in this report that we've done. But there's much more out there, and I think there's much more that's been done in this country as well. So, before I finish, I just wanted to cover, just to sort of tell you where we've been. So we've looked at the climate, that it's warming. We've looked at it, the fact it's us, and we're sure it is. We do know it's bad for our health, including our mental health, and we do know some of the things we need to do to address this problem. So I hope I've sort of left you with some hope that things can change and that things you can do in your professional life as well as your personal life. And I look forward to seeing some of you at the panel discussion, which is later on this morning, where we'll be able to discuss it in a more interactive way, I hope. But thank you very much for listening, and thank you to my colleagues in the Planetary Health and Sustainability Committee at the college.